Hello and welcome to the Urban Polling and Activator online workshop for allied health professionals. My name is Juliette Fritchie and I'm an Australian Urban Polling Master Trainer. I'll be taking through this, the second video of your core module course, and this one is on activator polls. So here you see the activator polls in use, and most of you will have a set of activator polls with you now. If you haven't, please go and get them and we'll be able to have a look at them together. Okay, this is a little look at the activator polls being used in a real life situation. This is an elderly gentleman aged 83 at the time, and he had a traumatic injury which made him have very poor mobility, and he wasn't able to walk very far until he took up the poles. This is him walking now. He now walks several kilometres a few times a week.
Hello everyone.
And he is now going to be doing a charity walk with his poles. So you can see how he walks with that. And if you notice, his elbows were bent, which is the one thing in urban polling that we don't want, but in activator polling technique, that is what occurs. The other thing that you might notice, we might see another little bit there, is that the poles are quite vertical. So there you go. These are the poles that he is using, and these are the poles that you will have with you now. The activator and the activator 2 model. So here is the activator poles. You should have those. These are our usual model of activator, and the one that most people will use if they need an activator pole. The difference between the activator poles and the urban poles are in the tip. So it has a bell-shaped tip, very similar to those used with crutches, and the button extender mechanism, which allows a little bit more weight to go on the poles. They're more secure. And it still has the extended mechanism going that way. The core grip handle is the same as all the models of pole on the urban polling group of poles. The other model there is the Activator 2. This is the Activator 2. It's a 3-piece model of pole. And the reason that urban polling developed this was that people were saying they had some very tall people. So activator poles will suit somebody up to about 6 foot, about 188 centimetres, maybe a tad more. And then there were people who were finding that they had clients who were a little bit taller than that, and they wanted a taller type of pole. So these are 3-piece. They use a similar mechanism. They still have the push buttons, but they have 3 pieces, so 2 extended pieces. They have a much more secure mechanism for attaching as well. So if somebody needs activator poles and they're traveling, or if they're extra tall, then these are the ones that you would use. But for most people, the activator poles, the normal activator poles, are quite enough. And they're a very much simpler mechanism, and they're lighter as well. So they tend to be the one that I go to by choice. And then I use the activator 2s if necessary. So these are the features. They have the button lock mechanism, as you can see. The maximum weight on the pole is 90 kilos. So we recommend up to about 113 kilos for a patient. And if you have Activator 2, around about 140 kilos. And I think I have a correction to make from the ordinary urban poles. Their maximum weight is 103 kilograms for a total weight of a person. So this is the maximum weight of the Activator 2 is 145 kilos. They have the bell-shaped tip, you can see there down the bottom. The pole is held in a vertical position and it has the same anti-vibration features that the urban pole has. So that is, you have the shelf on the core grip handle, which every pole has. You have the ferrule, which is that middle black bit, and you have the bell-shaped tip. So that provides a little bit of anti-vibration feature. They are adjustable, so this is the ordinary Activator pole, adjusts to a person's height of about 183 centimetres. So why did urban polling develop the Activator pole? Well, that is because of this particular document, which was a study that Béchard did, and he looked at dynamic knee joint loading with poles held in different positions, backwards, forwards, and sort of sideways and vertical. And he found that greater offloading occurs when the poles are held in front and applying a downward pressure on the base of the grip. So that means that if you want greater offloading for knees, hips, ankles, you are much better off to hold the poles in a vertical position. So this is the difference between an urban pole or a Nordic walking pole and the Activator pole. So Nordic walking poles have straps, urban poles do not. Activators are strapless. Urban poles, if they're Nordic walking poles, they usually have a very thin grip. If they're urban poles, you've seen the urban poles, they have the usual grip. The Activator poles all have a core grip. Urban and Nordic walking poles have a twist lock system, usually of extension. Activator poles have the button lock system of extension. Just gives it a little bit more security. Nordic poles will go from a weight bearing capacity as low as 10 kilograms per pole. The urban poles are probably the highest that you can get security wise. That's 40 kilos per pole. Activator poles, because of those button shaped tips, have that greater sense of security. Urban poles have a boot shaped tip. Activators have the bell shaped tip, the flat bottom tip. Urban poles are used diagonally, pushing backwards, and they propel the user forward. But the Activator poles have the upright, you're holding them in a vertical position, and that provides upright stabilization. So it's the difference in why you want to use the pole. If your goal is fitness, physical activity, energy usage, then you will go for an urban pole, and usually the people who use urban poles have a good internal balance mechanisms. Activator poles are used for stability, balance, and often as a gait aid. This is a photograph of our Stroll with Poles group, and the gentleman on the right has MS, and he is using Activator poles. So you will see he is using them with a bent arm technique. They're relatively vertical, and he has a foot drop, so he's wearing a splint as well. Myself and the lady on the left are using Nordic walking technique, so the urban poling technique with our poles angled backwards. So you saw in the previous video the changing from the activator pole to an urban poling technique. So because the tips are interchangeable, if you want to make the activator pole into an urban pole and an urban poling technique, then you just take off the bell-shaped tip, you put on the boot-shaped tip, ensure that it's facing, the boot-shaped tip is facing backwards, and then you can use the urban poling technique with an activator pole. This is my exercise group, and we do a little bit of walking, but also standing exercises in a park. This gives you an idea of the typical clients who might benefit from activator technique or from activator poles if they are required for a walking device as opposed to a fitness tool. So if they have some stability problems with their normal day-to-day walking, especially outside, they might be more likely to want to use an activator pole. Gait retraining, so somebody who has a variable gait, an asymmetrical gait, has some poor trunk control, then gait retraining would work quite well with the activator pole. Post-surgery, especially older adults post-surgery, also hip and knee surgery. We, in Canada, that's the largest group of clients who use the activator poles. Also back surgery. If you want somebody with a very upright stance and to activate their glutes, then activator poles are quite good for that as well. People with limited grip strength will, as we spoke about in the previous video, they will don't need to use a lot of grip, and that it's a nice ergonomic handle. Some OTs put, if somebody has a real problem with grip, or if they need a slightly wider grip, they put a sticky foam, and that might make it a little bit more comfortable. You can also put that along the shelf as well. People with balance and stability issues related to chronic conditions such as Parkinson's, for example, and frailer older adults who are in retirement to aged care might use them also. So here we have Dr. Jack Taunton, who is the medical expert attached to the Canadian Olympic team, and he has had a lot of spinal surgery and finds that he can do long walks, good long walks with activator poles, and he can't do that with his normal day-to-day because of his spine. So what activator poles do is they promote a more normal gait pattern compared to a walker or a single point stick. You get that arm swing, you can actually stride out with it. If somebody has been using a walker long term, I would be very cautious about going onto poles because they are more challenging. They do require you to have some hip extension and some core and trunk control. So it's usually contraindicated for those people who are certainly for those who are long-term walker users. I will sometimes use them as a standing balance, as an exercise tool, rather than a walking tool, but use your own clinical judgment in that. So this is a lady who's on a walker, and it's a comparison with using the activator pole. So you'll see the difference in her gait. I might see if I can redo that. So the right-hand side is the walker and the left-hand side ooh, the left-hand side is the using the activator. I can't get it back up. Sorry about that. This is a stroke demonstration of somebody who has had a stroke and the difference between using a single point stick and something that will give you bilateral support. So you will notice a typical stroke pattern. You get a collapsing of the normal side. You get a twisting and an asymmetrical pattern. You get hip hitching on the left, and you get the attention. So all that visual, proprioceptive, even auditory attention is going to the normal side, and you get a neglect of your affected side. And you also get no use of the upper limb on the left-hand side, which is the affected side on this particular person. So let's look at exercises with poles. I have an outdoor exercise group. Most people are familiar with indoor exercise groups. And on the right-hand side, you'll see a group of older adults using activator poles. And this is a pre-standing, so they're doing forward, backward translation. You can also just come up a little bit onto your feet and then come back down onto your bottom. So it's that kind of work you can do with poles. The two people on the left-hand side are using it post-orthopedic surgery. So it does allow you to be quite versatile. It also gives you a little bit of, they're quite, you don't need a lot of space for pole use. So it does allow you to use them in a small situation, especially if you're doing home care visits. I do quite a lot, and you really don't need much space at all for exercises. So they can be done on a one-on-one using exercises or in a group situation. And I have to say that my exercise group, who are just starting back now, are so keen to be out there and exercising with their poles. They just love them, and it gives them that camaraderie and something that they have in common, something unique that they have in common. Here is the research with activator poles, specifically to do with activator poles. There are 9 ongoing current studies with activator poles, and they deal with falls prevention, COPD, offloading of the knee joint, in aged care, looking at spinal conditions as well. So if you want to know more about that, then that's the website to look at, the details of the website. Effects of activators in these particular clinical conditions have included improved balance, normalization of gait pattern, an upright posture, falls prevention, reduced impact to lower extremities, core strengthening, that whole clinic to community, so the ability to take the poles and use them in your normal day-to-day life or when you're out in the community, and improved psychosocial measures as well. One place where I have seen activator poles used to very good effect is if people have a property or a large yard and they like to get out in the yard and it may be a little bit uneven. That means that walkers don't work so well, but it's even more important than being inside, having something that gives you stability. So urban poles are quite good, activator poles are quite good in that situation. This is a closer look at a falls prevention pilot study that was presented last year in Canada. So it was a pre-post study. They looked at older community dwelling adults, and they did 9 weekly classes of it was an hour-long class, but 30 minutes of actual exercises, and they did walking in that. So this was based on the exercises were based on the Otago Falls Prevention Program, which are very simple exercises. They are hip abduction, hip flexion, hip extension, those particular types of exercises, but they used the poles to stabilize themselves while they did these. They found that there was an improved timed up and go from the beginning to the end of the program, an increased stride length with walking, and increased single leg stalk stand. So just a single leg stance. This is a gait assessment study, and we have some videos on this. So this is a 88-year-old lady who has had a number of replacements, 2 shoulder replacements, 2 hip, 2 knee, a neck fusion, and a soft tissue injury from her ankle. And this was done on a Xeno walkway, which has a whole lot of sensors in the walkway, which will give you a whole lot of different measures of gait. So here we have her without the poles. She took 21 steps to get to the end of that walkway. You'll notice she's using her arms quite a lot for stability. She's got a wide base. That central footfall, you can see it's a very flattened foot. She doesn't get much toe dorsiflexion at all. She doesn't get much heel strike. And on the right-hand side, you will see the gait variability. So really she has quite an asymmetrical and variable gait. So here she is walking with poles. And you'll see immediately she gets that longer stride. She took 14 steps to get to the end this time. And if you notice that central foot patterning, she gets heel to forefoot to toe. She's getting a heel strike, which is quite lovely. And she's getting a nice, even patterned gait. So have a look on the right-hand side, that figure 8, and it's a much more symmetrical pattern that she's getting in her gait. These are the results when they analysed them. Walking without poles, she had an increased speed. So her speed increased by 37%. Her step length increased by 62%. She had a decrease in her step width of 2 centimetres. And her gait variability improved. So that's a measure of gait variability. The lower it is, the better your gait is. Her cadence slowed down, so she had a much nicer, regular cadence. So the one thing that did happen that was quite exciting was that she got that heel strike, foot roll, and then the toe off at the end, which she didn't get without the poles, probably because she felt much more secure and stable. She could actually do that and get that foot roll. So we're going to look at the activator technique now. And this is a video, we're going through to a video of how to put the poles up, and I'll talk you through that as we start. So this is setting up the activator poles. And you will see she's got the poles quite shortened, in a shortened space. She's got a left and a right. She's unwrapping the poles now. So it's kind of a Velcro-y type thing. And then all you need to do is to just wrap it round and it'll stick to itself. So you have a section on the top, put your hand on the top section, the bottom section, just pull it out Turn it until you see the white stripe that comes through onto the, through the holes. So she pulls out and she'll eventually find a little button that'll pop into the holes, and that's the way you can increase your height. With activator poles, the length is at 90 degrees. If you hold your arms at 90 degrees, and the pole vertical, that's where you want the pole to be. There is no, there is just numbers on the mechanisms there. So then she's just doing that with the second pole. She's pulling out, twisting it. She's finding the white line, getting the push button, and then adjusting it to her height. So she's just saying how secure the pole is now. That's the carbide tip. So if you take the boot tip off, you'll end up with the carbide tip. Very unusually would you need to take the bell bottoms off for the carbide tip, but you might. So here we have the activator technique. It's a much simpler and more intuitive technique than urban poling. And we'll do that now. So there she has the poles. They're held vertically. You can see her arm is at 90 degrees. If you have the choice between a little high and a little low, go a little lower. Make sure you've got the left in the left hand, the right in the right hand, and make sure your grip is light. It's not a tight touch. Nice and tall, lift your rib cage and shoulders back and down. So it's an opposite leg and arm again. Left pole, right foot. The thing that a lot of people do is they bring their poles a little bit too far in front. You really don't have to put the poles too far in front. It's a bit like using crutches. You put it at the level of your feet. You will walk slower because you're not doing a wide stride and you're only moving your pole a short distance. So just be aware that it's not a fast walk. It'll slow you down if you're a normal walker. As you push down on the core ledge, your core abdominal muscles will tighten as with urban poling. So now we'll just have a little look at her walking. So that's on grass. She's probably a little slower than most people would walk with an activator pole. She's walking probably at the speed that most people would walk in that last little clip. So that's the activator technique. It's not that hard. I usually get people to start off with one foot in front of the other in a stride stance. Then I set up their pole. So if they're stride stance with their left foot in front, I will then set up their pole so their right pole is at the level of their left foot. And then I usually just say, just walk now, just walk. And sometimes it's better to less is more with teaching people to walk with activators because it is really a simple technique. If they get it wrong, I usually wait a few steps because if they've got a decent amount of space in front of them, and that's pretty important, they sometimes just come into a normal pattern after a few steps. So be aware of that. And if they are consistently wrong, then I stop them and I set them up again and off I go again. But it shouldn't be a really difficult technique, and most people can get it fairly quickly, which is really nice, because a lot of people who use the activator poles have difficulty with their mobility, and quite often when they go to therapy, they're doing a lot of cognitive work, they're doing a lot of thinking and learning and concentrating. So if you can give them something that's fairly easy and fairly intuitive, it's a really nice way to increase their confidence and their self-efficacy. So here we go, just going through the 4-step activator technique again. Left and right, make sure you have the left in the left, the right in the right, and make sure you have your little finger resting on the pole. Nice light grip. Stand upright, elbows are slightly below 90 degrees, and the poles are vertical. And then you're stepping forward with the left leg and the right arm together, the right leg and the left arm together. And just a tip there, not to grip the handle too tightly, and to swing from the shoulders. So not to clench your elbows into your sides, but to keep your shoulders swinging. If you want to have more support, then you're pushing down on the ledge to increase that strengthening. It increases offloading and it helps with your balance. So a marching beat, a clicking, the usual things that you would do with your urban polling technique. So left, 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 left. Don't focus. Again, it's like switch your brain off and just walk. It is much easier if you have a space. So if you have like 10 meters or so that they're not having to think about hitting the wall or having to turn, that's a good thing to do. And as with crutches and sticks and anything, don't pivot when you're turning. You just do little small steps and you keep the pattern going left to right, right to left. So these are the errors that you might find using the same arm, same leg. And if you start with the opposite arm, opposite leg, that can correct that quite easily. Again, don't overemphasize the teaching at all. Let them go and see if they get into the pattern on their own. Gripping the handles too tightly, if people are really concentrating hard, they might do that. So sometimes I notice that when they've been walking for a while and it's something that I'm busy looking at other things, and then I suddenly notice that they are gripping a bit hard. So you can, so keep that in mind also. Keeping the shoulders and the arms locked. So that's what I was talking about, these elbows by your side and not moving your elbows at all. You should still swing from the shoulders. So you can just practice that as a movement. The other thing that you might find is they might be a little high. So you can always bring the poles down a notch if you need to. All the steps that we are going through here are guides only, and you will find that different people use slightly, you know, they modify the technique slightly, or you might modify the technique, or you might find that the poles are better down a little bit. So these are a guide, but there's no real hard and fast, this is the way you do it, and no other technique will work. You might have to just modify slightly to get the correct technique for your client. And if they start to use the pole diagonally, it'll probably mean they're walking faster, they're more confident, and they're not needing so much support. So you may be able to progress them to an urban polling walk if they're doing that. Please notice very much when you're practicing activator walking, how slow you do walk. It's not a fast walk, it is a slow walk. And be aware that the people that you're dealing with who will need this are not fast walkers. They are slow. They'll be a much slower walker than you are. This is a double polling method and worth having a go at. I've used it once with a woman who had a total hip replacement and was a little bit, she lacked confidence really on that hip. And it could also be that they might have a little bit of pain. That means that their gait isn't normal. And you can use a double polling technique in that case as well. So exactly like using crutches with the affected leg. The other reason that you might use it is if you're on rough ground or crossings, a stream, or something that's a little bit uneven, you might want, and you use you use activator poles generally, but you have one affected leg, you might find that the client will go on to the double polling just for that particular area where they're a bit less secure. So on rough ground, or if they're on a property or something like that, they might use it a little bit more. So both poles held together. Again, you're only putting the poles at the level of your foot. You're not putting them in front of your foot. And these are the precautions and contraindications that we look at for the use of activator poles. Acute stages of frozen shoulder, tennis elbow, early stages of total hip and total knee replacement. Walkers and crutches are more appropriate when they have to put a lot of weight through their legs. So remember that when people go from, if they've just had an op or they've just gone onto a walker and you want to see if they can go onto activator poles, be aware that activator poles are more challenging to use and you can't put as much weight on them as you can on a walker or crutches. So it will feel a little bit challenging just because of that. But the flip side of that coin is that you're using all your muscles. You're using all those hip extensors. You're using your abdominals, your trunk muscles. And that's what you want people to do, basically, to normalize their gait. So early stages, total hip, total knee, they have more pain. They need more weight taken off their affected leg. So a walker or crutches may be more appropriate from up to about 4 weeks or so. Middle late stage conditions resulting in moderate to severe balance problems. So when people are getting to have a lot of difficulty with walking, they might find they need something a little bit more, with a little bit more support. Severe RA or OA, you might have to just look into that. If people have some RA or OA, it shouldn't be too much of an issue because they have a light grip. But you might find if people, pain is your guide really here. Severe acute cardiopulmonary conditions, just because of the extra effort involved with any sort of cardiovascular workout. If they've got severe neglect or visual limitations, they might be a danger to themselves or others with that. Subluxation of the shoulder is also, especially acute subluxation, is also a contraindication. People, as I explained before, long-term walker or crutches users, single point stick users usually can manage with poles quite well. And don't forget, you can also go to a single pole, which we'll look at in the stroke video. People with ataxia or very poor coordination, if they're going to be a danger to themselves or others, then you will need to, they might be better off with another sort of aid. And people with poor judgment or insight. It might take a little while. It tends not to with activators, but certainly with urban poles, it might take a little while for them to get the pattern, get use of how it works. And it might be also because they're using more of their muscles, they get fatigued more quickly. So it might take a while for them to build up a kind of an endurance with activator poles. So that's it. And we'll now give you a chance to practice with the activator poles, and I will see you in the next video.